reason why we selected this topic is because this particular season in the private practice we see a lot of asthmatic patients because it's a winter cold atmosphere, and usually we get a lot of asthma and respiratory problems in this season. So I thought we shall discuss this topic, which can be useful to a lot of people. So before starting the discussion on bronchial asthma, let us discuss some anatomical part of the upper respiratory system. I believe that managing any disease is 50% medicine and 50% is patient education. That's why I'm more interested to talk to people and teaching them about their diseases. Looking at the anatomy of upper respiratory tract, here you can see that the upper part is the nose, below there is a mouth, and there is a common connection between nose and mouth which is called as pharynx. This part is called as pharynx. And then the food goes behind and the wind and air goes in the front in the windpipe. This is the food pipe and this is the windpipe. This part is called as larynx. So today we are going to basically focus on this part of the body, which is upper airway. This is the windpipe, which is called as trachea, and the bronchus. I would also like to tell you about a little bit about the examination of mouth. When we examine the patient, we usually check the mouth and nose with our light. So when we tell them to open the mouth, what we see is the tongue. Then there is a flesh called as uvula, which hangs in the between. And there are two small glands over here, which are called as tonsils. Upper respiratory infection usually starts with mouth and nose. Patient usually comes and tells, we had some exposure to dust or something, we had cold drinks or ice cream, and then we started having throat pain. The next day they start developing a little bit nasal discharge. So basically it is this area which starts getting affected by any of this viral infection. And then if the infection proceeds further, these tonsils, which are smaller in size, it enlarges and there are pustules and pus pockets seen on the tonsils. So then we call it as tonsillitis. They complain of throat pain and burning in the throat while swallowing food. Basically, before starting to discuss bronchial asthma, let me just talk a little bit about common cold also, because these things are quite related. Common cold is, as we know, it is basically characterized by watering from the nose, a lot of sneezing, maybe burning in throat, including pharyngitis. It is caused by a lot of viruses. The rhinovirus is one of the commonest known viruses to cause common cold. I hope you can appreciate this picture. This is the schematic diagram, and this is the original picture of the patient. Like we discussed, here there are tonsils, uvula, and the posterior wall of the throat. In this patient, you can see it is very much red and congested. Basically, it should be pink, very light pink color, but because of inflammation and infection, there is too much congestion over here in the throat. Everything looks red as if it is covered by blood. And then the patient experiences very severe throat pain because of that infection and congestion. So signs and symptoms are sneezing, stuffy, runny nose, sore throat. When the discharge from the nose and throat goes down into the upper part of the windpipe, it irritates over there and patient starts complaining of dry cough. Because the windpipe, cough is a protective reflex. Anything goes into your windpipe, it is not allowed. It has to be thrown out. So you cough. When you cough, with the air, the foreign particle comes out. So patient starts complaining of dry type of cough, watering from the eyes, and associated headache and body ache. That is a part of fever which they get. So what do we do when this type of symptom starts? Should we run away directly to the doctor? No, that's not the thing. Generally, all these viral illnesses gets better by themselves in say 5 to 7 days. You need not take any medicines for that person. What you have to do is few home remedies. Like if there is too much watery discharge from the nose, you take steam inhalation, plain steam inhalation at home 2 times in a day. Brush your teeth twice, gargle with warm water, drink a lot of liquids and when you do steam inhalation, if you have got a lot of stuffy mucoid discharge in the nose, with that warm steam, it starts getting more watery and it comes out. So when you take steam inhalation, you cover yourself with a cloth, apply some, you can apply some eucalyptus oil or Vicks balm on your throat, and just take deep breathe in and out. Like this. And you keep one handkerchief with you. Whatever discharge comes out, it starts melting and it starts comes out, you take it out. So once it is out, it will not keep on producing further and further. It will be stagnant inside your nose and in the sinuses, then it starts becoming more and more infected, and then you start getting more and more ill. So you try and take it out, those discharge. And by taking steam, because it starts melting, it is more easier to take it out.
See, inhaling through the nose or mouth?
Inhaling through the nose. Yeah, it is. Because exhale through the mouth. But you can do either ways. There is no compulsion like that. Basically, nose is meant for inhalation and mouth is meant for exhalation. That is a basic physiology. But then there is no compulsion. If there is discharge, you may not be able to breathe so easily with the nose. So you can do it other way around also. Brushing teeth 2 times. Again, the plaques between the teeth contains a lot of bacteria. So if you keep your mouth and oral part clean, you start becoming better faster. So you brush your teeth 2 times. After brushing, you just gargle it out so that the throat part and the pharynx part, all the stickiness comes out. So you don't keep on having irritation and dry cough. You will feel much better in that. You need to drink a lot of liquids, because when you are coughing, when you are having this upper respiratory infection, there is a lot of dryness actually in the throat, and that gives you more irritation and pain in the throat. So if you take a lot of liquids, you keep yourself hydrated, so it does not become dry and the irritation and pain is less. So keep on sipping a lot of warm liquids, because obviously generally patients feel better by drinking warm rather than any cold thing. And wash your hands frequently, because these things many times it is sometimes it is contagious because of discharge. If the hands spoiled with the nasal discharge, if you touch somewhere, some other person can also get it. So you wash your hands frequently. Especially this week when there is a component of conjunctivitis in the patient. Conjunctivitis, we have seen people advised to wear glasses. But actually that glasses is not for, देखने से वो नहीं फैलता है. It does not spread by seeing. Otherwise, doctor is the first person to get conjunctivitis. It actually spreads by hand, by touching. You invariably.
Just like a contagious disease.
It is contagious. When you have got conjunctivitis, what do? You rub your eyes. And when you rub your eyes, the discharge comes on your fingertips. You touch somewhere else, somebody else touches over
He
it.
will get
it. And he will get it. By wearing glasses, what happens? Even if you are having itching, but when you try to scratch your eyes, the glass will come in between. So you will not be allowed, subconsciously you will not be allowed to touch your eye actually by wearing those glasses. That is the concept of wearing glasses and conjunctivitis. It is not direct contact. So you wash your hands frequently so that you don't transmit it to other people. By doing these steps, basically, within 3 to 5 days, if it is simple common cold, it will resolve. You will not require any medicine. This we have already seen. So message is good oral hygiene is equal to less cold and cough. Now let us start with today's topic proper as bronchial asthma. I would like to take some feedback from you. What do you understand about bronchial asthma? Sir, आप बता सकते हैं?
Difficulty in breathing.
Breathing, good, very good. Any other thing?
Difficulty in breathing.
Breathing, okay. Difficulty in breathing. Yes, basically it is in a common public it is known as difficulty in breathing. Medically speaking, if we talk what is bronchial asthma, then it is a sensitive and hyperreactive airway disease causing difficulty in breathing. Difficulty in breathing, why? See, basically, this is the windpipe which starts from here. यहाँ पर common pathway है, बाद में यहाँ से the windpipe starts. Then it divides into bronchus, and then small airways further. So what happens is there is some problem over here because of which there is difficulty in breathing. Now let us see what it is. Patient commonly complains of difficulty in breathing. They complain of whistling like sound while breathing, like as if you whistle or as if you blow through a small pipe. That is called as wheezing. This is the airway. Again, I am explaining this diagram. And when you see, if I cut it from here, it looks like this. It is normal. This is the normal airway. It is open like this. The pipe is open. In bronchial asthma, what happens? Because of some trigger factors and because of inflammation and swelling, the pipe becomes narrow. And when the pipe becomes narrow, you feel difficulty in breathing. Now this is episodic in bronchial asthma. It is not continuous. After some time again it can open up and you feel it completely better. So you would have heard of patient people in the society. उसको अस्थमा का अटैक आया. अदरवाइज अच्छा था. वो घर पे आया, रात को सोने गया, वापस उसको अस्थमा का अटैक आ गया, एकदम ब्रेथलेस हो गया. वापस 1-2 घंटे में कुछ डॉक्टर ने दवा दिया तो ठीक हो गया, एकदम अच्छा हो गया, नॉर्मल ब्रीथिंग करने लगा. So what happened? In that attack, this pipe which is completely open like this, because of some trigger factor which we will be discussing now, the pipe becomes narrow. And when it is narrow, he is not able to breathe efficiently. So then there is labored breathing. He has to take efforts to breathe. And because the pipe is narrow, there is resistance for the airflow. Air cannot flow so smoothly, there is a resistance. So the sound comes like whistling. If you are going through a big pipe, there will be no sound. But a small pen cut top line, if you blow, then that whistling sound comes. So if the pipe becomes narrow, the flow of the air produces that sound. Basically, the breathing part is simple. When you exhale, the air goes inside from this pipe. It expands your lungs. And when you exhale, the air comes out. The chest presses inside and all the air comes out. So this is what is normal breathing. Any doubts?
No. But if we do pranayama, say Anmol Vimol, take one, I think that is
yeah, we will come to the treatment part of it. We are discussing what exactly happens in the definitely will come. So what I wanted to explain you in this is this. This is the normal open windpipe. When you are in a normal state, we are breathing. At the moment, we all are having this type of windpipe, which is completely fully open windpipe. Air can flow easily to and fro, so we are breathing normally. We don't have any problem. When there is some trigger factor which causes, like we saw the redness in the throat, inflammation and swelling in the throat. If there is some swelling on the inner wall of this windpipe, so this was normal, it has become red now, it is like inflammation now, the swelling over. So the effective lumen of this windpipe has become smaller, the diameter has become smaller. So at this moment there is narrowing of the windpipe. So patient starts experiencing slight breathlessness and mild wheezing. थोड़ा breathing में sound आता है and breathlessness. And then when it is very severe, suppose if he does not seek any medical help over here, and if he is like deteriorating further, then what happens with this internal swelling, the external muscles, there are muscles surrounding the windpipe. And the windpipe, उसके आजू-बाजू smooth muscles रहते हैं, which contracts and relaxes. So if that muscle contracts further, then there is further narrowing. See, it is compressing like this. Then there is further, it is almost obstructed. Patient is not able to breathe at all. Then he gets that attack. He cannot lie down. He cannot move from here to there. If he moves, he starts getting breathless because that windpipe is completely closed with lot of swelling inside. When there is swelling, there is lot of production of cough and mucus. So there is lot of mucus inside over there, small cough droplets inside, and external compression. So there is external compression, lot of inflammation inside, along with some production of cough because of inflammation. And then there is no space for air to flow in and out. So patient becomes more and more breathless. So when there is severe narrowing of windpipe, there is an attack of